Hello, and welcome to Black Doctors TV. My name is George Pride. I'm the CEO of Black Doctors USA. Today's discussion is all about keloids in the Black community. One of those things that just been there for decades and decades, that now we have an opportunity to talk to a physician and also a corporation, our sponsor today, that will allow us to help and assist people in the community that are experiencing keloids. The first individual we'll bring into the broadcast is Dr. Carl Truesdale. Hello, Dr. Truesdale. How are you?
Good morning. I'm great. Thank you. Thank you for having me. Very excited to be here.
Hey, thank you so much for being part of Black Doctors USA and one of our guests today. You know, what's funny about what we do at Black Doctors USA is experiencing all the different physicians and healthcare professionals across the country. It's been a very, can I say, well-received blessing for me to be able to communicate, to have you as part of our network, to have all you guys as a part of what we're doing. And it's just a blessing. And I'm just so grateful to have you here today with us.
Well, thank you.
What led you into becoming a plastic surgeon?
Well, it's a lifelong journey for me. Started very early after a sibling of mine passed away, and my dad, he's a scientist, so always around science. My mom, she's an artist, so had the science and medicine and, purpose to be a physician at that young age, made it happen. And then when I got to medical school, I realized I wanted to be a surgeon and use my hands. I have a lot of hobbies that I use my hands with, and found out about head and neck surgery, otolaryngology, and within that, there's facial plastic and reconstructive surgery. And so it's kind of really what I'm supposed to do on planet Earth, melding my artistic background. I'm a portrait artist, and my surgical acumen, and just a desire to really help people. So I've ended up in the right place and happy to be walking in my purpose.
You know, it's nothing more wonderful than to realize what your calling is on this earth. And I know, based upon what I'm doing here today, is part of my calling. And it was a threat really from my mother that projected me into healthcare. And so now I understand when someone says, look, I know what my purpose is. I know what my calling is. I can identify with that very, very well. So thank you so much for sharing that. What's keloids? What is that? What it's all about?
So the first thing we need to think about when we're thinking about keloid is the healing process. So a keloid is when the body is trying to heal itself. And normally the process of healing, there are three different, components of the healing phases. But, a keloid is where one of those processes does not happen the way it's supposed to occur. And so normally when you have a laceration, or maybe you're poked, or you get a tattoo, or a piercing, or really any kind of trauma to the skin is supposed to just heal together. The two edges become one, and you're left with a scar, a normal scar. There are different types of scar, but one abnormal scarring pattern that we see is a keloid, and that's an overproliferation of the scar tissue or the collagen aspects of the scar. And so we, as scientists, are still trying to understand this process of keloids. It's a tumor, a benign tumor or growth. Doesn't mean that it's cancerous, but it grows outside of the borders of what the normal defined limits between scar tissue and normal skin are, as opposed to a hypertrophic scar, which is a raised scar but does not go outside of the border of the area of injury. So keloid scars are very detrimental to the people that experience them. Predominantly people of darker skin types, but keloids can happen in really any skin type. More frequently in the African American, the Latino, the Asian populations, but really anyone can have a keloid. There is a familial predisposition to having keloids, but we fully don't understand that as well. So a lot to be understood and a lot to learn about keloids. Keloids, as they relate to affecting patients, they cause obviously some disfigurement depending on where they're located. They can cause itching. Multiple studies have shown that they negatively affect patients' quality of life, the way that they feel about themselves. So it's a huge burden of disease, especially when you're thinking about the 11 to 18 million people each year who suffer these conditions. So really a clinical challenge for physicians and patients.
Excellent. That's amazing. I didn't know it was that the population was that large for keloids across the country. That is amazing. Other than the embarrassment and self-esteem that one can that can occur from keloids, what other physical conditions are there that persist?
So a lot of it depends on where the keloid is. And so if you're thinking about keloids as it relates to what I do, facial plastic surgery, if you're thinking about a keloid on the ear or the neck, it can actually impair the function of certain organs. So if you imagine you have a keloid that's completely obliterating the external ear canal, it could affect your hearing. If you have a keloid that is in a certain part of your face, certain motions or aspects of chewing can be affected, or if it's in the neck immobility or restriction. So it depends on where the keloid is in terms of the detriment that it can have. On top of that, they're painful. Patients complain of pain. They complain of severe itching. And, it can really make patients depressed. It can lead to anxiety and issues in their personal lives. So it's really a condition that affects people on the full spectrum of their lives.
What experience have you had with keloids?
So in residency, I completed my head and neck surgery residency at the University of Michigan recently. And, we take care of patients who have keloids. Very commonly in areas in the head and neck, that's around the neck, as it relates to acne or ingrown hairs, patients who have had piercings in their ears, even young patients. So that is my experience with keloids. Primarily as a surgeon, we cut keloids out. There are multiple treatments for keloids, and none of them are 100% perfect. And a lot of strides have been made as it relates to keloid treatment, but we're still working on it in terms of being able to really take care of these patients, understand the disease process, and nip it in the bud. So that is my experience so far.
All right, thank you for that answer. You mentioned Michigan. Well, I'm in Ohio, so is this a go blue, Buckeye thing here we got going on? What are we talking about here?
The go blue version. Yeah, basically.
There you go. I'll give you that for today. Once the broadcast is over, it's all about the Buckeyes. Okay. Going into my next question. What are some of the things that can cause or trigger keloids, and why are they so challenging to get rid of?
So a keloid is a response to injury to the skin. And so anything that injures the skin, from laser to tattoos to just really local trauma, a poke in the skin, surgery can cause keloids. Really bad or imperfect surgical technique, really anything that punctures the skin and the skin needs to respond to that by healing itself can cause a keloid. So that was your first question. Your second question was, what can we do to treat them?
Mm-hmm. Yes.
So there are multiple treatments, and there is no one algorithm or agreed upon treatment for keloids as it relates to the scientific literature. A lot of research has been done on different treatment modalities, and they all have different benefits and risks, as well as recurrence rates. One of the tricky things about keloids is they come back. And the reason why they come back somewhat has to do with the patient's genetics and their own body's milieu. But it's thought to be due to these inflammatory factors, growth factors, inflammatory cytokines that recruit cells, and those cells that are supposed to help the body repair itself are supposed to in some way quiesce or turn down. In a keloid, that process keeps going on and on and on. And so when you think about having a little cut on your chin, usually in a couple of days, that skin should heal over. But in a keloid, that whole process of proliferation, the cells that lay down the collagen, they lay it down in an unorganized fashion. That collagen doesn't contract. That collagen continues to be kind of stimulatory. So we don't fully understand why that happens, but it does. And so that's what makes them very difficult to treat. If you just take a keloid and you cut it out and you have negative margins, which means that you cut the entire keloid out and you sew it back together, that keloid can come back. And even if you have the best surgical technique in the world, the recurrence rates are upward of 45 to 100% with surgical excision alone. And so even if you're a good surgeon, which some of us like to be, you can never fully guarantee that the keloid won't come back. But there are different treatments that you can add along with surgery, including silicone sheeting, injection with steroids, injections with other chemotherapeutic agents, external beam radiation, laser treatment, pressure therapy. There are a variety of treatment modalities that can be used to supplement and use adjuvantly with surgical excision that can improve or decrease your recurrence rate.
You know, that's why this show is so wonderful, because our sponsored guests, Census Healthcare, you know, they have a solution for keloid scarring. And I want to bring in our sponsored guest right now and their president, CEO, Joe Sardano. Mr. Sardano, can you join us, please?
Good morning, everybody. How are you all?
We're good. How are you?
Good. Thank you for having me.
Oh, you know, it's a pleasure. It is most certainly a pleasure. What's interesting to me is, you know, all the, can we say, wonderful information that Dr. Truesdale just provided. But now to bring you and your organization into the questioning and the answering is just going to make this program even more special. So I'm really excited here with Black Doctors USA, Black Doctors TV, to have you, Census Healthcare, and Joe Sardano as part of this discussion. So if I may, how does the SRT 100, how does it work, and what conditions does it treat? And before you answer that question, every time I see the SRT 100, I think of the Chrysler and Dodge products, because I was raised around Chrysler and Dodge. My grandfather and uncles always had the Mopars. So when I see SRT, I'm like, wow, the only thing I can think of is a car. So I'm not thinking properly, right? But I'm back on track a little bit. But back to the question. Go ahead,
I think you are thinking properly. High performance, great engines, and they go. So
there you go.
Compared to our SRT. And I want to thank Dr. Truesdale for the eloquent introduction of what keloids are all about. There's not a lot of doctors that really know the subject or really understand the subject, but Dr. Truesdale definitely demonstrates that he understands what this problem is and how we can correct it. But superficial radiation therapy as supplied by Census Healthcare is a very light radiation known as photon radiotherapy. It only penetrates about 5 millimeters below the surface of the skin. And our original FDA clearance was to treat skin cancers, which are usually between 2 and 3 millimeters below the surface of the skin. So it's an excellent technology to treat those skin matters. We had a former president of the American Academy of Dermatology approach us and said, you know, your product is perfect for treating keloids. You should look into it. So we started looking into it. We started doing some studies, and then we went through the FDA process saying we can cure, we can help with keloids. And that's how we got into keloids. So we're proud to say we're the only company that has FDA clearance to be able to treat keloids with our technology, namely very, very light superficial radiation therapy. And since we've implemented the program in certain markets within the country, we've been extremely successful. And early on, it was really felt by me when I was witnessing these early patients that were being treated. And George, you and I talked about it, but there was a young lady who came in with her dad into a clinic in New York, a plastic surgeon who had a terrible scar between her lower lip and her chin. And she had been in a car accident, and it really impacted her from a mental attitude, mental standpoint. She was going into her senior year in high school, and her father said to me that, you know, she's a very outgoing, social girl who everybody seems to love, and she loves life as large as it is. And she had kind of recessed over the past year. She refused to look into a mirror to look at herself, because it reminded her of the day that that accident occurred where she lost her best friend. And so that scar was really a terrible scar, not just only on her face, but on her soul and her spirit. And she was very, very depressed. And, you know, can you imagine kids today going to school? We're all faced with these things that are taking pictures of everybody every time, every minute of the day. And she refused to have any of those pictures taken of herself. So she was hoping that this was going to be a change. And about 6 months later, I came back to the facility when the doctor was doing follow-up with her, and she came into the room and she had this beautiful smile that lit up the room. And I looked at her with her father next to her. I said, "Do you remember me?" She said, "Yes, I do." I said, "How's it going?" She said, "I got invited to the prom." I couldn't hold myself to look at her, okay, because my eyes just burst in tears. I had to turn away. And I knew that this was not just a clinical or medical obligation. This was a social obligation, that we had to get these folks back on a level playing field so that they had the same spirit, the same life ahead of them that everybody else has. And I saw it in this girl's eyes. I saw it in her smile. And I can only imagine what she's doing in life today, because she was very bright. She was extremely pretty, and everybody deserves that chance. And so it's become a mission of Census Healthcare for us to find the right doctors. And Dr. Truesdale, you're one of them. With the knowledge that you have, with the skill that you have, this is an opportunity for us to go after those 11 million to 18 million people that are suffering from keloids, that we can make a difference in their lives. And that's important to us. So we've been systematically working with doctors across the country, training them on how to do it. And it's a very, very simple process. The publications that we've shown, George, is that we can cure up to 90% of keloids, as much as 100% on keloids. We did a study on ears, as you mentioned, Dr. Truesdale, in your presentation. We've shown with a modest number of patients, about 30 patients, a 94% cure rate on curing the earlobes of keloids. And we've had many other people with drastic keloids that we've been able to help, who have suffered for years and years and years. So I can only imagine what it does for the earlobes and some of the other simpler things that we're looking at. But there is a cure, and it is a combination of the skilled hands of a Dr. Truesdale, along with superficial radiation therapy, showing 3 treatments, and we can prove that you're going to have a better than 90% that this doesn't come back with 3- and 4-year follow-up so far. So we're excited to be able to talk about it.
That's wonderful. I mean, that is really wonderful. For me, there's always a moment in everyone's life that propels you into understanding what your goals are and what you're here to accomplish. So what does it mean exactly for you, to have a device, the SRT 100, that assists people in that manner?
Well, it's funny. We're trying to bring the scope of relevancy for the technology with regard to keloids to the same level that we've achieved with skin cancer. Everybody knows that skin cancer is a very, very big epidemic, if you will. It impacts people that are mostly over 65 years old. And there are 6 million people in this country that have diagnosis for skin cancer each and every year, and that's going up 6% a year. Here we have more people with keloid problems, and it doesn't seem like it has the same emphasis in the market today with some of our healthcare providers. And a lot of it has to do with being able to get it reimbursed. So we have a fight on our hands with the third-party insurance companies that say, this is a cosmetic problem. It is not a cosmetic problem. Dr. Truesdale eloquently described exactly what the problem is, what the cause of it is. We really don't know, but it is hereditary. It is something that's in our DNA. It does impact people of color mostly, but my mother was blonde and blue-eyed and had a massive keloid down the center of her chest after bypass surgery. And it was ugly, it grew, it impacts everybody. So this is something that we've got to create awareness for, because there is a cure, because these people who've been suffering with keloids have been hiding it all their lives, because for the most part, they've been told decades after decades, don't touch it, because if you cut it, it's going to grow, it's going to get bigger, it's going to get ugly, because that's one of the characteristics of a keloid. Well, now with good doctors in place like Dr. Truesdale and a few others, we can make this a relevant program. We can cure this. And then we've got to really put pressure on the insurance companies to pay for this. We've got to put pressure on the government people to help us with that. This is not a cosmetic thing. This is a clinical thing, and we've got to help the people who suffer with it.
If I may, I would like to share some photos in regards to before and after effects of the SRT 100. And as the photos are being shown, I'm going to ask you another question. How have you reached out to the Black community pertaining to your device?
Well, we've been very, very disciplined in looking for key opinion leaders that will spread the word on this. So our very first installation and approach to this market was with a plastic surgeon out of New York City who understood this market, who is an African-American physician, and he looked at this as a major problem, especially for a lot of his patients in the New York City area. He has certainly made it a very, very good business opportunity for himself and his practice, but his main goal is to treat patients who suffer with keloids and to rid them of the problem. We have another doctor in Orlando, Florida, also a plastic surgeon, who treats people from all over the world. And quite frankly, he'll treat people whether they can pay or not. But he wants to rid himself of, help the patients with keloids. And so slowly, little by little, we're starting to see this expand, where number one, doctors do have to pay for their business. They have to have a return on investment. We're working very, very hard with them. We work very hard and diligently with the government officials, with CMS and everybody else, so that they can put pressure on the insurance companies to pay this. And so where we persist, we win, because you can't keep this away from people who suffer this kind of thing.
I want to thank you again, you and your organization, Census Healthcare, for this opportunity to be able to get this information out to the Black community, Black and brown people. It's important. It really is. And the problem in healthcare is the lack of information or access to. And when we are able to have a program to, can we say, exude who you are, show your passion and your understanding of a deficit that we have within certain communities, and for your organization, Census Healthcare, to take that next step to say, hey, let's create something, let's develop something, and let's make something available to the people that need it the most. It's a very blessing opportunity and a very blessed opportunity. And I'm very appreciative of what you've accomplished and how we can continue to help you get into the African-American community more and have more physicians across this country understand who you are and what you have to offer. I want to bring Dr. Truesdale back into the discussion in regards to see if he has any questions for you. And Joe, also, I want to see if you have any questions for Dr. Truesdale. Dr. Truesdale, thanks for coming back. You have any questions for Mr. Spadano?
No, I would love to use your device. Actually, multiple patients already have reached out to me to treat their keloids. And, up to this point, I have not used your device. I have used some of those other adjunctive procedures and modalities in terms of lasers and compression, pressure therapy, silicone gels, mitomycin C, bleomycin, some of those other things that we inject into these lesions to try to decrease the recurrence rate after surgical excision. But I would love to use your device, so send me one.
We love to work with you on that project. And yeah, we have done thousands and thousands of patients now over the last few years with tremendous success, with follow-up as much as 3 and 4 years with no recurrences. So that's been exciting for us based on the protocols that we've devised. I wanted to talk to the point, you showed pictures of some of our patients. There was one patient that had a lot of keloids around his face. People like this, like Mr. Tony Perkins, people like this are what motivates us. I want you to look at this gentleman who's about 60 years old, who started with keloids at around 9 years old, and was going through all kinds of treatments. And he just told his mom that I can't go through these treatments anymore. They hurt too much. And the power that this gentleman has, he's a school teacher in the St. Louis school district. They asked him to move from middle school to the toughest school in St. Louis because they weren't getting the response from the students who were joining the high school ranks as they were, before. In other words, about 50% of the kids that would be eligible to go into high school weren't coming in for high school. They would just drop out and be left out in society. And he was brought into that position to encourage these kids because all his life he was able to reach kids. He's a track coach on top of that. And there are teachers and kids throughout his history that have requested to be in his classroom and to be part of his team. And so that shows you the power, the personal power that a gentleman like this will have and persist in just being an example to our youth. And now you can see how his life has changed with the way he looks today and how he's able to talk. We've given him a platform to speak on various occasions wherever we have that platform. And talking and listening to his personal life story means so much to a lot of people. And I think the people like this are what motivates us. And I'm sure Dr. Truesdale does the same thing. He sees the results that he can provide people, and those results are what encourage you to move on. And so we're excited for that opportunity, and we want to work with as many doctors as we possibly can. Dr. Truesdale, you're a perfect example of that. You've got the passion for it, you've got the knowledge behind it, and more importantly, you've got the skills, and we can make this happen. We can impact a lot of people. So I appreciate the opportunity.
You know, what's amazing, again, is access to care. And that's what this is all about. Having individuals understand how they can communicate to organizations and physicians to get the care that they need, to improve their overall health. And this is just, this is a blessing. And I can't say it enough to have the two of you here today. And most importantly, you know, Census Healthcare sponsoring this opportunity for us to be able to talk to Dr. Truesdale, to be able to get this information out to the communities across the country. So I'm just so appreciative again. Is there anything else either one of you would like to add or say, please?
I would just say, thank you for hosting this podcast. And, I think you've hit the nail on the head. A lot of the issues in the Black community relate to access of knowledge, access of care. And forums like this really increase and broaden the exposure of what people know about keloids, something that affects, I have family members who have keloids. I have family members who have hypertrophic scars. I take care of these patients. And really, up to this point, a lot of clinicians over hundreds and thousands of years have been perplexed on how do we treat these? What is the best way to take care of this? And thankfully, technology and good surgical technique, which continues to evolve, we're getting closer to those answers. I am looking forward to the day that a keloid or the problems that keloids cause these patients is a thing of the past. That's really the goal. We'll always have to deal with them, but if we're able to cut them out and take care of them, that would be my true kind of heart's desire for these patients. So thank you for allowing, certain people to, have this access to this information in this kind of forum. So I'm really excited and honored to be here today.
Well, thank you so much. And Dr. Truesdale, how can one reach you if they want to communicate with you directly?
Sure. So you can visit my website, drtruesdale.com. You can send me a direct message on Instagram, dr.truesdale. Those would be the best ways to reach out to me. On my website and on my Instagram, you can find the number to my office if you'd like to make an appointment for a consultation or discuss any concerns. Primarily, I perform facial plastic and reconstructive surgery, and that relates to all things cosmetic and reconstructive of the head and neck. So if you have any concern in that regard, I work and live in California, in Los Angeles, Beverly Hills. So that's where I'm currently a fellow. So happy to discuss or take care of you in the future.
And I'm very gracious to have you part of the Black Doctors Network. They can also find you at blackdoctorsusa.com. So again, thank you so much today for being here. And it's just a wonderful opportunity. Thank you, Dr. Truesdale.
Thank you.
Joe?
Yes, sir.
This has been wonderful.
We've got so much to achieve. We've accomplished so much in a very short period of time, but now we need to have patients become aware that there is a way that they can get rid of their keloids. We have hundreds of patients from all over the world that access our website on a regular basis, hundreds every week. And when you hear the stories that they talk about themselves and how it's impacting their lives, it really is heartbreaking to hear that these folks have not had an opportunity the way they should have that opportunity. So we're very, very blessed to be able to have access to these patients who are accessing us, and then we provide direction to our doctors and our doctor networks who are able to treat, who have been trained to treat. And so we're very, very pleased to be able to move these patients on to successful solutions with doctors who are using our equipment and as well as using their fine hands to make these things happen. So we're excited.
And your web address is censushealthcare.com, correct?
Correct.
Excellent. No, this has been this has been wonderful. I appreciate you and your organization for sponsoring this program today. I look forward to having your corporation, your brand, and our brand work together across this country to resolve this issue that we have. I too have family members that have keloid scars, and growing up, you never knew what they were. It was just the name was there, but how it came about, we didn't know. We didn't have the knowledge, and in some communities, it's unfortunate that the information is just not there. So with this, I'm very eager, and I want to be very aggressive with you and your organization in getting this out through our Black and brown communities across this country. I think this is great.
We appreciate it. We're willing and ready and able to work with you and your doctors wherever we can.
This is something that and this is kind of offbeat, and sometimes I always do that, and I drive my producers crazy when I do these kind of things. But for me, I get approached by a lot of different organizations a week saying that they have a solution to different things in healthcare. And as you sit there and you look at it, you say, this is not a solution. This is something that you've come up with that you want to make money off of. Well, no, this here is a solution. The SRT 100 is a solution. So I'm very excited about this. And I want to thank you again today for joining us. And it's just been a pleasure having you and your organization to be a part of this programming today. So thank you again.
Thank you. The pleasure is all ours. Thank you so much, George.
Thank you. That was very powerful. That was very educational. BlackDoctorsUSA.com is where you can go to receive information like this weekly. We are producing weekly programming with corporations across this country. We're producing weekly programming with doctors across this country to help educate the communities, you who tune into us, to view us, to follow us. Thank you. Thank you so much for being a part of blackdoctorsusa.com. If you're in need of a healthcare professional, again, go to blackdoctorsusa.com. It doesn't have to be an African American or a Black doctor. If you need medical assistance, go see a doctor. But if you so choose to have a Black doctor, go to Black Doctors USA. Thank you so much. As always, stay healthy, stay safe. Thank you.
Thanks for watching. If you enjoyed the video, please like it, share it with friends and family, and turn your notifications on for future episodes.